10 warning signs your body might send weeks before a heart attack. This information could save your life or someone you love. Did you know that every 40 seconds, someone in the United States has a heart attack? That's over 800,000 people every single year. These statistics are backed by the Centers for Disease Control and Prevention, CDC. But here's what most people don't know. While many heart attacks occur suddenly, your body may sometimes send warning signs intermittently for weeks or even months before it happens. In this video, we're breaking down the 10 silent warning signs that most people ignore until it's too late. Stay until the end because number 1 is the most overlooked sign that could be happening to you right now. Before we dive into the warning signs, let's understand what's actually happening during a heart attack. A heart attack occurs when blood flow to part of your heart muscle becomes blocked, usually by a blood clot. This blockage prevents oxygen-rich blood from reaching that section of the heart, and without oxygen, the heart tissue begins to die. But here's the critical part. This blockage doesn't always happen overnight. Sometimes, it's a gradual process that your body desperately tries to warn you about. Several factors increase your risk: high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of physical activity, and family history. Age matters too. Risk increases for men over 45 and women over 55. The good news? When you recognize these early warning signs and take action, you can prevent a heart attack from ever happening. Now, let's get into those 10 warning signs your body is crying out for help. Unusual fatigue that won't go away. Imagine this. You've been getting your regular 7 to 8 hours of sleep, but you wake up feeling absolutely exhausted. You struggle through your day, feeling drained even after simple tasks like making breakfast or walking to your car. You think maybe you're just stressed or getting older, but this fatigue persists for weeks. This isn't normal tiredness. This is your heart struggling to pump blood efficiently throughout your body. When your heart can't deliver enough oxygen-rich blood to your muscles and organs, your body has to work much harder to perform basic functions. This creates an overwhelming sense of exhaustion that rest doesn't fix. Studies show that up to 70% of women who have heart attacks report experiencing unusual fatigue in the weeks leading up to the event. This symptom is especially common in women and is often dismissed as just being run down. If you're experiencing persistent, unexplained exhaustion that's interfering with your daily life, don't ignore it. Warning sign number 9. Shortness of breath during normal activities. You're climbing the stairs to your bedroom, something you've done thousands of times, but suddenly you're gasping for air halfway up. Or maybe you're doing light housework and find yourself needing to stop and catch your breath. This is one of your heart's clearest distress signals. When your heart isn't pumping effectively, your lungs don't get enough blood flow. This creates a backup of fluid that makes breathing difficult. You might notice you're short of breath even when you're resting or doing activities that never caused problems before. This symptom can appear weeks or even months before a heart attack, gradually getting worse over time. Many people adapt by simply doing less, thinking they're just out of shape, when in reality, their cardiovascular system is struggling. Pay attention to any changes in your breathing patterns, especially if shortness of breath is accompanied by other symptoms on this list. Warning sign number 8. Persistent indigestion or stomach discomfort. You just finished dinner and suddenly feel a burning sensation in your upper abdomen. You reach for antacids, thinking it's just heartburn from that spicy meal. But the discomfort keeps coming back day after day, even when you haven't eaten anything unusual. Here's what's alarming. This might not be indigestion at all. It could be your heart. The nerves that sense pain in the heart are located near nerves that sense pain in the abdomen. When your heart is struggling, the pain signals can get confused, making you feel like you have stomach problems instead. This symptom is particularly common in women and is frequently misdiagnosed as acid reflux or digestive issues. The difference? Heart-related discomfort often comes with a feeling of fullness or squeezing in your upper abdomen, and it doesn't necessarily get better with antacids. If you're experiencing persistent stomach discomfort that seems unrelated to food, especially if accompanied by nausea or vomiting, take it seriously. Warning sign number 7. Sleep disturbances and insomnia. You used to sleep through the night without problems, but lately you're waking up multiple times, feeling anxious and unable to get comfortable. Some nights you can't fall asleep at all, or you wake up suddenly feeling like something's wrong. These sleep disturbances aren't just stress. They could be your body's alarm system going off. When your heart isn't functioning properly, it can trigger your nervous system's stress response, making it difficult to relax and sleep. Additionally, lying flat can make breathing more difficult if fluid is building up in your lungs due to poor heart function. Research shows that nearly half of people who have heart attacks report experiencing unusual sleep problems in the month before the event. Women are particularly likely to experience this warning sign. If you're suddenly having trouble sleeping and can't identify an obvious cause, especially if you feel better when propped up on pillows, this deserves medical attention. Warning sign number 6. Increased heart rate or irregular heartbeat. You're sitting quietly reading a book when suddenly your heart starts racing for no apparent reason. Or maybe you notice your heartbeat feels irregular. It skips beats, flutters, or pounds in your chest in a way that feels distinctly abnormal. This is your heart literally telling you it's struggling to maintain its normal rhythm. When your heart muscle is damaged or not getting enough oxygen, it can disrupt the electrical signals that control your heartbeat. This can cause arrhythmias, irregular heart rhythms that feel like your heart is racing, skipping beats, or beating too hard. These episodes might last just a few seconds or several minutes. They might happen when you're active or completely at rest. Some people describe it as feeling like their heart is flip-flopping in their chest. While occasional heart palpitations can be harmless, persistent or frequent irregular heartbeats, especially when combined with other symptoms, should never be ignored. Quick thing before we get to the top 5. If this information has been helpful so far, give a like so as to get this video in front of more people who might need to see it. And if you want more content like this, feel free to subscribe. All right, let's talk about warning sign number 5. Warning sign number 5. Unexplained sweating. You're sitting in a comfortably cool room, not exerting yourself at all, when suddenly you break out in a cold, clammy sweat. This isn't the warm perspiration from exercise. It's cold, uncomfortable, and feels completely wrong. This type of sweating is your body's emergency response to your heart being in distress. When your heart can't pump blood efficiently, your body activates its stress response, causing you to sweat as if you're in danger, because you are. This sweating often feels different from normal perspiration. It's described as cold, clammy, and sometimes accompanied by a sense of doom or anxiety. Many heart attack survivors report that in the days or weeks before their heart attack, they experience episodes of breaking out in a cold sweat for no apparent reason, often during rest or sleep. If you're experiencing unexplained sweating episodes, especially at night or accompanied by other symptoms on this list, seek medical evaluation immediately. Warning sign number 4. Jaw, neck, or back pain. You've developed a persistent ache in your jaw that you attribute to grinding your teeth. Or maybe you have ongoing neck or upper back pain that you blame on poor posture or a bad mattress. But what if this pain is actually radiating from your heart? This is one of the most commonly missed warning signs, especially in women. Your heart doesn't have many pain receptors, so when it's in distress, the pain signals travel along shared nerve pathways and can be felt in seemingly unrelated areas, your jaw, neck, shoulders, or upper back. This is called referred pain. The pain might come and go, worsen with physical activity, and improve with rest. Unlike muscle pain from injury, heart-related pain often feels deep and poorly localized. You can't point to exactly where it hurts. Many people spend weeks treating these symptoms as dental problems or muscle strain, only to later discover they were early heart attack warnings. If you have unexplained jaw, neck, or back pain that's persistent or comes with physical exertion, don't dismiss it. Warning sign number 3. Swelling in your legs, ankles, or feet. You notice your shoes feel tighter by the end of the day. When you press on your ankle, an indentation remains for several seconds. You might see visible swelling in your feet and legs that's getting progressively worse. This swelling, called edema, is a clear sign your heart isn't pumping blood effectively through your body. When your heart weakens, blood flow slows down, causing blood returning to your heart through your veins to back up. This creates pressure that forces fluid into surrounding tissues, particularly in your legs and feet, where gravity makes the problem worse. The swelling might start subtle, just feeling like your shoes are a bit tight. but it can progress to obvious puffiness and even cause your skin to feel stretched or shiny. You might also notice you're gaining weight rapidly, several pounds in just a few days, from fluid retention. If you're experiencing persistent swelling in your lower extremities, especially if pressing on the area leaves an indentation, this requires immediate medical attention. Warning sign number 2, persistent cough or wheezing. You've developed a nagging cough that won't go away, no matter what cough medicine you try. Or maybe you're experiencing wheezing and feel like you can't take a deep breath. You don't have a cold or allergies, but the cough just won't quit. This seemingly innocent symptom could be a critical warning from your failing heart. When your heart can't pump blood efficiently, fluid can back up into your lungs, a condition called pulmonary edema. This fluid irritates your airways, causing a persistent cough or wheezing that's often worse when lying down. The cough might produce white or pink-tinged mucus, indicating fluid in the lungs. Some people describe a wet or rattling sound when they breathe. This symptom often worsens at night when you're lying flat, which is why some people need to prop themselves up with pillows to sleep. A chronic cough that seems unrelated to illness, especially when accompanied by shortness of breath or wheezing, should be evaluated immediately. It could be your heart calling for help. Warning sign number 1, chest discomfort that comes and goes. Here's the number 1 warning sign that people most often ignore. Chest discomfort that appears, disappears, and comes back again over days or weeks. Most people expect a heart attack to announce itself with sudden, crushing chest pain. But that's not how it usually works. Instead, you might feel a sense of pressure, squeezing, or fullness in the center of your chest discomfort that lasts a few minutes, goes away, then returns a feeling like someone is sitting on your chest pain that worsens with physical activity and improves with rest. This is called angina. It's your heart muscle crying out for more oxygen because blood flow is restricted. It's essentially your heart's final warning before complete blockage occurs. The discomfort might be mild enough that you can push through it, which is exactly why it's so dangerous. People often dismiss it as muscle strain, stress, or indigestion. They wait until pain becomes unbearable, losing precious time when early intervention could prevent a full heart attack. Here's what makes this the most critical sign. When you experience this symptom, you're in the danger zone. Your heart is already struggling with reduced blood flow. A complete blockage could happen at any moment. If you're experiencing any form of recurring chest discomfort, especially during physical activity, do not wait. Seek emergency medical care immediately. Taking action can save your life. Here's the truth that could save your life. Heart attacks are often preventable, but only if you listen to what your body is telling you. If you're experiencing one or more of these warning signs, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, or a family history of heart disease, do not delay seeking medical attention. Call your doctor or go to the emergency room. Don't worry about feeling embarrassed if it turns out to be nothing. Medical professionals would much rather evaluate a false alarm than see you ignore real warning signs until it's too late. Remember, time is muscle. Every minute that your heart is deprived of oxygen, more heart tissue dies. But when caught early, many heart problems can be treated effectively, preventing a heart attack entirely. Share this video with your family and friends. You might save someone's life just by spreading awareness. Important medical disclaimer. The information in this video is for educational purposes only and should not replace professional medical advice. If you're experiencing any of these symptoms, consult with a qualified healthcare provider immediately. Always call emergency services if you suspect you're having a heart attack. Thank you for watching, and remember, your heart has been beating for you every second of your life. It's time to listen when it asks for help. Don't forget to like this video, subscribe to our channel, and hit the notification bell for more life-saving health information. See you in the next video, and take care of your heart.